Hello, I'm Paul Harper. I'm a professor of operational research in the School of Mathematics at Cardiff University. I've been in Cardiff now since 2007, and it's a wonderful place to be. It's a beautiful and friendly city. Also, it's a great school to be in, with a lot of friendly colleagues, and the OR group has a lot of expertise across the range of operational research and analytics and data science topics. I'm also the director of the Data Innovation Research Institute. This is a research institute which brings together many staff and students across the university who are all passionate and want to learn and want to research in data science, analytics, and modeling techniques. So this is me in the mid-1990s, a much more youthful-looking Paul with more hair than certainly I have now. But the point of this slide is to show that this is how I got into operational research, research for healthcare. I spent my summer in 1996 in, you might recognize that monument or landmark. It's the gateway to India in Mumbai. So I spent my 3-month MSc project working with HIV and AIDS patients and modeling predictions in India. And there were big concerns over resource issues, big queues for waiting and treatment, and how the disease would spread through the country at that time. So this really was my way into realizing, if you like, that mathematics and operational research actually could be really useful for healthcare and helping to improve services, save lives. And that's been my research, since my PhD, really, when I was working with many hospitals back in the UK. So I'm going to talk to you very briefly about some of the methods that I use and the group here use in the healthcare work, but in wider applications as well. And these are some of the methods that, as an MSc student, you will be taught, some of them by me, some of them by my colleagues, during the master's year here at Cardiff. So a whole range of important techniques from discrete event simulations and modelling flows of individual patients through pathways, and you'll be learning some queuing theory. System dynamics simulation models are underpinned by ODEs, which basically simulate the flow of populations and over time. We use game theory and routing games. This is to look at decisions around which queue to join, for example, and a system can cope under different strategies. And more recently, some really exciting research in agent-based simulations and game theory. This is, for example, showing how individuals interact with each other and how behaviours are important in propagation of disease and so forth. Forecasting, a fundamental aspect of our discipline. You'll be learning techniques in forecasting. Optimization, again, another fundamental OR approach. This is an example applied to timetabling theatre schedules in the local hospital, complex timetabling problems that require the use of optimization and heuristic methods. Location allocation model. So where do you locate hospitals or resources or ambulances over a geographical network in order to reach out to people in a quick time or to save lives? And machine learning and data mining tools are obviously important too in terms of understanding the data that we collect nowadays on a large scale. Of course, at this time, unfortunately, SIR models are in the news a lot, but we teach that, I research in this area, and also we teach this to our students on my healthcare modelling course. This is susceptible, infected, recovered type models, which you no doubt have all heard about, and the value of R0 and so forth. And so we look at models that look at prediction of spread of disease in healthcare modelling course. Just very briefly, some of the impact from our research at the group here. It's been fairly impressive. So, for example, reducing stroke mortality by 60% and by trauma by 54% by applying some of our methods, working with hospitals in south of London. The group here helped to design a whole new 111 NHS help service, and that has had a big impact again in reduction in unnecessary ambulance journeys, and therefore making sure ambulances are there for those who absolutely require them and to help save more lives for the most critical. And recently we have done a lot of work at the team here to help design a whole new hospital, £350 million new build just outside or just not far away from Cardiff, near Newport. And This is an exciting opportunity to apply OR to all different aspects of planning and designing a new hospital. And in fact, that hospital actually opened a year early, temporarily, to help with the coronavirus outbreak. And again, thanks in part to the OR that helped design that hospital and the capacity required. Just to finish off then, so we embed our modelling into NHS Wales. So if you do come here as a student, and or if you want to come here to research even, then use loads of opportunities to work with healthcare partners. We work very closely. We embed our modellers, our mathematicians, our operation researchers who spend time in the hospital and time in university. So we have a very close relationship with many hospitals here in Wales, which is very exciting. It means that we can get on and do some really important work. The group has been successful. We have brought in, as a result, lots of income in terms of funding opportunities and PhD studentships and awards, for example. I think probably one of my proudest days as an academic certainly was on the bottom right there. You might possibly recognise that portrait of the person behind me. That's Lord Patrick Blackett, who is the father of operational research in wartime here in the UK. And that was receiving the companionship from the OR Society 2 years ago, which was in recognition of my contributions to OR. And it was a real privilege, not just to get the award, of course, but also to receive it with Patrick Blackett looking over the proceedings, which was quite special. And as an MSc student, we have an exciting range of healthcare-related projects. Here's just some pictures from previous cohorts of students. So you spend 3 months over the summer months working on a project. We make a bigger effort here in Cardiff for MSc students in the OR and data science degrees to actually work on a project of real-world importance. So you will be spending time working, for example, like these previous students, working with hospitals that we collaborate with and working on some really important and interesting projects. Deploying your OR skills to a range of really important challenges, whether it be stroke or heart disease or COVID or anything like this. It'll be quite exciting work making a real impact. Well, obviously, by watching this, you're already interested in operational research and data science and so forth. If you haven't already seen it, there's a fantastic website by the UK OR Society, Learn About OR, which you can access. And there's some good resources there for university students and to look at careers as well. Lots of short YouTube clips about careers in operational research and why it's such a valuable career. And at the moment, more than ever, we need OR and improved decision making for industry at a kind of time like this across the world. So your skills are certainly absolutely required, and you'll be trained on the MSc course in these kind of skills that are absolutely crucial for the workforce, and you'll be highly employable. All of our students go on to really good degrees, and they're very employable after the MSc year here in Cardiff. And finally, to finish, here's my website if you want to go on and find some more details, profpaulharper.com. I put a lot of short videos up there, for example, introductory queuing theory or the importance of variability or Markov models. They're all on online for you to look at if you can find your way. I've also got a Twitter handle there, and also my YouTube channel is also Prof Paul Harper. You can find more resources there. Well, it's been a privilege to speak to you. That's the end of my short talk. Obviously, wherever you are watching this in the world, I hope you're keeping safe and well, and I really look forward to seeing you in person, face to face, hopefully next year in Cardiff. So in the meantime, take care. And hopefully enjoy some of these resources and some background reading. Okay, bye for now.